And I feel that there are lots of myths about knee replacement surgery that people should understand and know about. And one of them is this age factor. And I have done surgeries in patients, in knee replacement surgeries in patients in their 20s to 30s, and also in people as old as 90. So I think there's a wide range, as long as the patient understands that they should not misuse the replacement afterwards. I find that partial knee replacement surgery is appropriate in the more younger population, if appropriate. But if they have a big lesion or a extensive arthritis, then why not a full knee replacement? These days, full knee replacements are fairly advanced and have a very long life expectancy. Which, so for example, if you ask me about how long knee replacement lasts, although I can't give you a specific answer to that, but all I can say that there is a good 95% chance that it will last 10 years, and there's a good 80% chance that it will last 20 years. And usually some surgeons say that there's a 1% failure rate per year. So for example, at 10 years it could be 90%, 20 years is 80% chance of survivorship, and at 30 years there's a 70% chance of survivorship. So as long as you look after the implant, I think modern knee replacements can last a long time.
Finally, few suggestions for our viewers.
Yes, I think it is important that if you have been advised knee replacement surgery, it is quite appropriate for you to ask your surgeon on what type of knee replacement he is considering, whether the implant is imported or made in this country, for example, whether it's going to be a full knee replacement or a partial knee replacement, or is that an option available to the patient. And the patient is quite in his right, or in her right, to get a second opinion when it comes to surgery. And I think most people in India do that anyway. Surgery is very expensive. Most of the implants that we get in the country are quite expensive, and patients do worry about paying a large amount of money for surgery like this, and maybe on the lookout for cheaper surgeries available. I strongly advise patients to think very clearly about that. If they cannot afford surgery, they should perhaps not have surgery done elsewhere where there is the surgeon or the hospital has limited experience in knee replacement surgery, because the consequences of surgery going wrong can be quite severe, and you might be left with more pain than before. So it is important that the patient seeks out the right surgeon, the right hospital for their surgery.
Thank you, doctor. Thank you very much for your valuable suggestions about knee pain and knee joint replacement surgeries. Hope it will be really helpful for our viewers. Thank you, doctor.
Thank you very much.
Doctor has given us a lot of information about knee pain and knee joint replacement surgery. So follow doctor's advice and be healthy. Keep watching TV7 Health Planet for good health.
Contact us, Dr. Udai Praksh, Orthopedic and Trauma Surgeon, Udai Clinic, Chapel Road, Hyderabad. Phone 7702 555 406.